Imagine this for a moment, my friend. You reach the peak of pleasure, your heart is racing, your body trembles, and everything feels completely normal. And then, boom, it's over. You look down, there is nothing, no semen, just silence. And in that moment, confusion sets in. You start asking yourself, what happened? Is something wrong with me? Or am I the same man I have always been? If you've ever felt this quiet panic, let me tell you this clearly. You are not alone. This is called dry ejaculation, and it happens far more often than most men are willing to talk about, especially after the age of 60. Now, as men, we talk freely about blood pressure, joint pain, diet, or backbone, but when it comes to sexual health, many of us go silent, and that silence often hurts more than the symptom itself. Before we go any further, if you value honest, science-based conversation about men's health, especially as we age, take a moment to subscribe to this channel, Dr. Emmanuel Bale. I post videos like this to help you stay informed, confident, and healthy. Now, back to the issue. Many men who experience dry ejaculation start avoiding intimacy. They are worried, they worry their partner might notice, so they feel embarrassed. Some even believe it means their masculinity is fading. But here's the truth, and I want you to hear this from me as a friend. A dry orgasm doesn't mean you have lost your desire. It doesn't mean you have lost your strength. It's absolutely doesn't mean you have lost your manhood. What it means is that your body is trying to tell you something. And most of the time, that message has a clear explanation and a solution. To understand this, you need to know one important thing. Orgasm and ejaculation are not the same thing. An orgasm is the sensation, the wave of pleasure, and is controlled by your brain and nerves. Ejaculation is the physical release, it is the coordination work of muscle and glands pushing out semen. So in a dry orgasm, the pleasure is still there, but the semen is missing because something in that physical process has changed. And there are three main reasons why this happens. Number one, retrograde ejaculation. This is when the semen flow backward into the bladder, and it often happens after prostate surgery or as a side effect of some drugs, especially those for blood pressure and prostate enlargement. And number two, blockages. The ducts that carry the semen can become scarred or blocked from past infections, inflammations, or surgeries. And when that pathway is blocked, semen simply can't come out. Then number three, low testosterone or nerve problems. Low hormones can reduce semen production, and nerve damage, often from diabetes or surgery, can also weaken the muscles that are involved in ejaculation. So most of the time, dry ejaculation is not dangerous. But, and this is important, if it starts suddenly and causes pain or you notice blood, you need to see your doctor right away. Those can be a sign of something more serious. But here is the good news. Dry ejaculation is treatable. Simple tests like a urine test, an ultrasound scan, or a hormone check can help to identify the cause. And treatment may involve adjusting the medications, doing a minor procedure to clear the blockage, or safely restoring the hormone balance under medical guidance. And please don't ignore your lifestyle. Good control of diabetes and blood pressure, regular physical activity, healthy eating, and proper sleep all play a huge role in protecting your sexual health. But the most important step of all is this: talk about it. Talk to your doctor, talk to your partner. Silence creates distance, conversation builds connection. Your desire does not have an expiring date. Your pleasure doesn't have an age limit, and your confidence is not defined by semen volume. Dry ejaculation does not define your manhood. So if this message speaks to you, take action. Break the silence, reclaim your confidence. Your body still works. Your passion is still alive. And your intimate life is far from over. And if you want more honest, practical guidance like this, don't forget to subscribe to Dr. Emmanuel Bale and share this video with a man who needs to hear this. And let me add something very important, my friend. Something many men are never told. A dry ejaculation is not the same as impotence. It doesn't mean you can't satisfy your partner. It doesn't mean your sexual life is over. In fact, many men with dry ejaculation still have strong erection, normal desire, and satisfying orgasm. The only thing that is changed is where the semen goes, and how much is produced. But here's where the problem begins. When a man does not understand what is happening, his mind fills the gap with fear. Fear leads to anxiety, and anxiety leads to performance problems. And suddenly, unmanageable medical issues turn into emotional stress that affect the bedroom. That's why knowledge is power. And if you have had prostate surgery, diabetes, long-standing blood pressure, and you are on medications like alpha blockers or antidepressant, dry ejaculation is not a personal failure. It's a non-medical effect. And let me speak directly to men over 60 watching this. Your body is changing, yes, but changing doesn't mean declining. It means adapting. Your nervous system, your hormones, and your blood vessels may not behave exactly as they did at 30s, but with the right guidance, they can still support a healthy, satisfying sex life. Now, one question I'm often asked is this: Doctor, should I be worried about fertility? If you are still struggling to father a child, dry ejaculation can affect fertility because semen is not being released normally. But even in most cases, there are medical options to retrieve sperm or redirect ejaculation, so don't assume all hope is lost. And again, the key is evaluation, not assumption. And another thing many men ask is, can supplement fix this? Be careful here. You need to be really careful here. No supplement can reverse nerve damage or unblock ducts or correct retrograde ejaculation on its own. Some supplements may support overall health, but relying on them instead of proper medical assessment often delay real treatment. That's why I always say use science, not guesswork. If you take just one message from this video, let it be this: your sexual health is part of your overall health. So ignoring it doesn't make you strong. Understanding it does. So please don't suffer in silence. Don't withdraw from intimacy. Don't let your fear rewrite your story. Talk to a professional. Ask questions. Get checked. And if this video helped you to feel understood, encouraged, or less alone, do these three simple things. Like this video so it reaches more men who needs it. And subscribe to Dr. Emmanuel Bale for honest, medically sound men's health advice. And share it with a friend or a brother or a partner, because this conversation matters. And remember, my friend, you are still a man. Your body is still capable, and your best years of confidence and connection may still be ahead of you. Thanks for watching this video.